Hello everyone, Janine here, and welcome to another session of Tips from the Trenches. So we are going to be looking at some myths surrounding dementia. But before we do so, it's important that we define what dementia is. One of the most common questions I get asked is, what is the difference between Alzheimer's disease and dementia? Well, first of all, dementia is not a disease. What it is a set of symptoms, with memory loss being one of those symptoms. There are a host of others, including apathy, lack of judgment, disorientation, depression, and many more. So think of it in terms of a fruit. There are many different types of fruit. If I have a banana, I have a piece of fruit. But if I have a piece of fruit, it doesn't necessarily mean that I have a banana. I may have chosen an orange or an apple. And so it's the same with dementia. If someone says, I have dementia, it doesn't necessarily mean they have Alzheimer's disease. They might have one of the other diseases that cause the dementia symptoms. Some of these are vascular dementia, Lewy body dementia, frontotemporal dementia, and others. So that is a very quick, high-level understanding of dementia. And if you'd like to dig deeper, you can look below at our links. So let's jump into some of the myths. Many people are of the opinion that dementia is just part of getting old, that it's inevitable. But this is not true. Dementia is not normal aging. Dementia is caused by diseases that damage the brain, as we've already discussed. Age, yes, it is a risk factor and does increase our risk of dementia, but then it also increases our risk of some of the cancers, of osteoporosis, arthritis, and other chronic diseases. Many people will live into very old age without ever developing dementia. And on the flip side, although rare, there are people in their 30s and 40s that have developed dementia. You know, changes in memory as we age can certainly cause us a lot of anxiety. Sometimes it's hard to distinguish what is normal age-related memory loss or what is something that is a little bit more serious, a red flag that needs more investigation. So think of this scenario. You finish work on a Wednesday and decide you need to go to Costco to get some groceries, and there you bump into a friend that you haven't seen for a year and decide you need to catch up. And so you make arrangements to meet each other on the Saturday at 12 o'clock for lunch at White Spot. And so on Saturday, you're in your garden and preparing it for some nice spring flowers, and your phone rings and it's your friend, and your friend says, Janine, is everything okay? You're supposed to be at White Spot. We made arrangements. And before she's even finished, you're going, oh my goodness, I'm so sorry. Yes, I forgot. I'll be there in 20 minutes. Or that same phone call happens, but your response this time is, what are you talking about? We made no such decisions, no such plans. I haven't even seen you in a year. So you have no recollection of that conversation. So that is just an example to show you the difference between what possibly is normal age-related memory loss, as opposed to something that is possibly, more serious and needs more investigation. So what do we do if we have concerns about our memory or of a family member or friend? In my intro last week, I shared that I would be constantly emphasizing the importance that you do not want to do the dementia journey alone. You know, dementia loves to isolate people. So when we look at people that are living with dementia and we ask them for their tips, specifically around this kind of example, you know, I've heard time and time again from people living with dementia that they wish they had not brushed their symptoms under the rug when they first started happening. You know, don't chalk everything up to just having a senior moment, because if it's not a senior moment, if it's something more serious, you are wasting valuable time. Talk to a family member, talk to a friend, make an appointment with your family physician or your healthcare provider. That is so important. Sweeping concerns under the rug usually just result in increased stress, increased anxiety, and as we know, that is very detrimental for brain function. Finding ways to manage your stress is really important for good brain health. Research shows us time and time again that living with chronic stress is actually a risk factor to developing dementia in old age. And so finding ways that work for you to manage your stress levels is important in reducing your risk. And if you have already been diagnosed with dementia, it is even more important that you keep your anxiety and stress levels down. Again, there are links below with more resources. And the one that I'd like to highlight is the Alzheimer Society of BC, which is a great resource and support system. And if you are outside British Columbia, outside Canada, please look up your local Alzheimer Society or Alzheimer Association for support and resources. So once again, thank you so much for joining us today. I really appreciate your time, and as always, I wish you peace, I wish you strength, and I wish you opportunities to create moments of joy today. Thank you so much.